Peds Patrol here, and many of you are starting residency this week. So as an early care physician and a new pediatrician, I thought I would reflect on 5 things that I wish I knew more about when I started residency. So I'm a double board certified pediatrician. I'm 2 years out of residency and have full-time staff. So reflecting back on when I started not too long ago, the first thing I would have done is definitely try to befriend everyone. So residency can feel like an isolating experience, and the most important thing is to know everyone and get to know everyone. Even if you're a social awkward or a super social butterfly, it's very, very important to join as many committees as you can, go to events, go to outings, try to go to your post-grad social events, because that's where you're going to meet people like you and also meet people with shared and similar experiences. Most of you will be working 40, 60, 80, 100 hours per week, and that's quite a lot on your body and your mind. So if you find people who share similar experiences as you, those will be the places to definitely check out. If you're a couple or newlywed, make sure to find other couples and newlyweds that might be either in your program or in your institution. Once you're done work, once you're done all your notes and co-signing all your things for your patients, you want to go out, you want to have fun, and these are people and places that you can check out and enjoy experience together with. All right, number 2 is advocacy. So I know they say residency, you're still learning, you're just graduated from med school and now you are an adult learner, but you technically are working as well. Just like any other person, you're signing a contract, you're being hired by an institution, whether it's a hospital or network, and you're employed to do certain hours and certain tasks. That is expected of you. So if your institution or hospital or city or province does not have a really good organization that manages residents and resident needs, you need to advocate for yourself. Like, can you actually sleep in your call room? Is there running water? Is there a shower? Can you have some supplies? What does your post-call hours look like? How soon after do you have to get back to work? Do you even have time to do anything else, such as pick up your kids from school, get some groceries, do the laundry? What is it like working with your senior staff, your junior staff, and the working environment with your nurses and allied health? Most residencies are not unionized, but they may have organizations that may support you. If you have any questions or concerns, talk to your program director, go to your post-grad, talk to medical affairs. If needed, you need to maybe talk to an employment lawyer to make sure that you're getting your needs met. Residency can range anywhere between 2, 3, 4, sometimes even 6 or 7 years with fellowship. So you're going to be there for a very long period of time. If the working conditions are not there for you or not adequate or unsafe, you need to let somebody know. That's a red flag. Number 3, so we always take time off if we're sick, but I think you need to also focus on your mental well-being. Like I said, you're working 40, 60, 80, 100 hours a week. You have to be functioning at 100% all the time, and you need to give 100% to yourself and to your others, including your patients and your staff. That's a lot of mental toll on your body as well. Check with your residency organizations if you do have mental health supports. For example, talking to a psychiatrist, talking to a therapist. Do you get spa days? Do you have some money set aside for massages? Sometimes hospitals offer them for free for any staff member. If you have children, can you maybe hire a nanny? And if you don't have time to cook, can you take out some of those meals on service that provide meals on a day-to-day basis? Residents don't make a lot of money, but they make some money, and you can try to take advantage of that. You're not going to get that time back. So if there's anything that you can do to outsource, you should definitely think about it. Some hospitals and organizations have work perks where you can look at discounts for a lot of things that are much more reasonable and more affordable. And of course, as you're getting along during the years of your training, you may meet with other people and you may decide to live in together or share a house together. Those would be opportunities for you to take a little bit of reprieve in terms of some of your daily duties that you need to do outside of work. Okay, so number 4, this is an interesting one. Residency is an isolating experience, but it's not a unique experience. You're now part of this brotherhood or sisterhood where we now share similar shared trauma. What this means is that you're not the only one who's also experiencing higher burnout, a lot of work, less time for yourself, less time for your family and your family's needs, or willingness to hang out with your friends. It's a huge shift in your schedule and in your life, and those 3 to 4 to 5 years can be quite a bit of a traumatic experience. Some programs even have a gray cloud on them because of the fact that they treat the residents in a not so pleasant way. There's always been some news that you hear both in Canada and the United States about residents who unfortunately have succumbed to mental health conditions or chronic comorbid conditions or passed away from struggling from residency. So it's very, very important that you connect with somebody that you can talk to, whether that's in your circle, in your program, or your post-grad, or any mental health services that are available to you. to get treatment early on. As an attending staff, and I'm sure other staff members will tell you, it definitely does get better on the other side. That doesn't necessarily mean that you have to suffer, compromise, or make sacrifices that are significant to your own health and to your own mental well-being. I think lastly, number 5 is to always check in with yourself. So make sure you circle back either every week, every month, or every quarter on why you're doing what you're doing. It's really easy to get lost in the hustle and bustle of residency. You're a high-level athlete, you never have time to relax and rest, but you need to reflect on why you're doing what you're doing. Is it because you want to help a certain population? Is it because you want to advance your career and be the top of medicine? Do you have a personal goal, a family goal? Why are you doing this? And what is giving you that daily motivation, either internally or externally, to get you where you need to go? Remember, you're part of this privileged collective, but it doesn't necessarily mean that you have to suffer with everyone else. So if you feel like there's some things that you can do, join an advocacy group, talk to your postgrad and start creating your own committees, or join a committee that can lead with example. If you feel that there's some deficits in your program, then work on them, address them, and figure out solutions that you can definitely try to incorporate into your program, so then your junior residents who are coming in can see the improvements that you're making to have their quality of life better for them. Just as we say, see one, do one, teach one, this is an opportunity where you can make meaningful, impactful change for all the residents to come after you.